What are the differences between central and peripheral pain pathways in migraine? Have you ever wondered how migraines can feel so intense and persistent? The answer lies in the way our bodies process pain signals. In the case of migraines, there are two main pathways involved: the peripheral pain pathway and the central pain pathway. Understanding these differences can help us grasp how migraine pain develops and continues. Let's start with the peripheral pain pathway. This pathway is all about the initial detection of pain signals outside the central nervous system. In migraines, this primarily involves the trigeminal system. Here, sensory nerves in the trigeminal ganglion detect harmful stimuli, like inflammation or blood vessel dilation in the protective layers around the brain. When these peripheral nerves sense danger, they send pain signals straight to the central nervous system. Now, what happens when these nerves are repeatedly stimulated? This is where peripheral sensitization comes into play. The nerves become more responsive or hyperactive, leading to increased pain sensitivity right at the source. So, if you have ongoing inflammation, you may feel more pain than you would normally expect. On the other hand, we have the central pain pathway. This pathway is responsible for processing and amplifying those pain signals once they reach the central nervous system, which includes the brainstem and spinal cord. A key area involved here is the trigeminocervical complex. This complex integrates sensory input from the trigeminal nerve and upper cervical nerves. When central sensitization occurs, neurons in this area become hyperexcitable. This means they can amplify pain signals even without any ongoing stimulation from the peripheral pathway. This can lead to symptoms like allodynia, where things that normally do not hurt, like a light touch, suddenly feel painful. It can also lower the pain threshold, making you feel pain even beyond the original site. To sum it up, the peripheral pain pathway is all about the initial activation of nerves outside the central nervous system, particularly those responding to triggers like inflammation. The central pain pathway, however, deals with how those pain signals are processed and amplified within the central nervous system. Both pathways play a role in the intensity and persistence of migraine pain. From a treatment perspective, targeting the peripheral pathways often involves reducing the activation of trigeminal nerves or addressing inflammation. This could include medications or nerve blocks. On the flip side, treatments aimed at the central pathways focus on modulating excitability and pain processing in the central nervous system. This might involve neuromodulators or behavioral therapies. Understanding these differences in pain pathways can help tailor migraine management strategies. By addressing both the initiation and amplification of migraine pain, individuals can find more effective relief.